Hey, how's it going?
Good. How are you?
I'm good.
Really excited to talk to you.
Yeah, thanks for having me. This is awesome. I'm on Instagram as at chronic.pain.coach, and then also my Facebook is public for everyone to find me.
Endometriosis, polycystic ovary syndrome, transformational lumbar inner body fusion, some spinal fusions, the L5 and S1,
Hmm.
myofascial pain syndrome, some reconstructive foot surgery. You too also have CRPS.
Yes.
So you know that very well. You're
Yes.
also a registered nurse,
Yes.
a chronic pain health coach. You're actually the founder of the chronic pain space,
Yes.
right? And then you're obviously a huge awareness advocate and out there reaching out to people that are suffering and trying to do all that you can.
I'm from Dallas, Texas, Dallas girl, Texan, born and raised. So I live here in Dallas, in the city, and it's awesome. I love it. And yeah, I've had pain literally as long as I can remember. So when I started my cycles when I was 11, they were super painful. And all the like women in my life told me that that was normal, that like suck it up, buttercup, like you're just going to have to deal with that. And as I like went to high school, into college and stuff, like all of that, it went crazy. I mean, it was like I could barely do anything. And I actually started college as an aerospace engineering major and had to quit college because of the pain. Also, during this, I had an accident where I fell 20 feet and hurt my back. So I had this chronic pelvic pain and then now this new back injury that just decided to all coagulate together and start to ruin my life.
Yeah.
It was pretty bad. I mean, your early 20s in college, you want to go explore, make new friends, get your degree and all this. And here I am wanting to, um, you know, die basically. And I quit school. I moved back home, lived with my parents again, which nothing against that, but it was just like I, it just took over. I mean, I had nothing. I was so depressed, so anxious just from how much pain I was in. And, I went to go see multiple different doctors, chiropractors, primary care, physical therapy, all the people they tell you to go see.
Mhm.
They're like, oh, just do this for 6 weeks and you'll be better. Well, that they kept saying that over and over and over again for, 4 or 5 years and like never got better. It's like, good Lord, what is going on? Um, yeah, and then on top of that, I had the pelvic pain. And so that's kind of a separate thing where I was going to see my OBGYN, finally had surgery. I had endometriosis. I got it excised. I started this treatment called Lupron, which I'm sure a lot of women are familiar with. That is absolutely devastating to your body. Like lost some of my hair, lost a bunch of weight. It was awful. Um, but however, it worked and I feel better from that. So at least that part of my life it was better by that point. But the back pain just was getting worse and worse and worse. And it was just, you know, the scan, like the MRI, wasn't as bad as the pain was. And I feel like that happens to a lot of people where you get like a vague diagnosis on your scan
Mhm.
and then they tell you have this thing and then you think that that's the only cause of your pain and so you're only trying to treat that and that's not the only cause and so the pain just gets worse and worse and that's what happened to me. um
Not addressing the comorbidities, right? That
yeah,
how how
yeah.
they're all kind of connected.
Exactly. And I didn't know any of this. I've been a nurse for 3 years, and this was all before I was even in nursing school. So I wasn't super familiar with like the anatomy and the body and all of that stuff. So that's what encouraged me to go to nursing school. I had quit school. I was just working, retail jobs and was exhausted and hated it. And so I was like, let's go to nursing school so I can help people because like if I can't like help myself, then I'm going to try to help other people. That was like
Yeah, yeah.
my thing. So I started learning more about the body, and then I started learning more about like the emotional side of things, the psychological side of things, and I started exploring that. And that is when my life got so much better. And I feel like I got a little bit lucky because my cause of my pain was mostly like emotional and psychological, but that is not the case for everyone. And so I don't want people to think that that is like
Yeah.
what I'm doing, I guess.
Right, right.
Um, but if it is, then I want to help you you know. And I still have physical stuff. I've got scar tissue. I have nerve damage. I do have CRPS. Sucks. Um, but now that, I know how to handle all of that together, and like I'll have my flares occasionally, I'm just able to like live my life, and I don't have that like fear that something's going to go wrong the next day. I had foot surgery in 2016. It was literally a bunion correction. Like I like never even wore high heels or anything. And I just had this toe that was like that. And they were like, we'll just fix it. Cause I was a runner or
Yeah.
trying to become a runner at that point, like a half marathon. And I was running and then the pain was just so bad. And I was like, I was like, I can't do this with my foot. So I had the surgery and my big toe just hurts most of the time.
Yeah. It
It's
causes.
better. It's better because it's the same side as the back stuff. And since the back nerve pain is mostly fixed, I feel like it feels better. But like the numbness and the tingling and the sharp, like stabbing pain, I just have to be really careful with what I do. I feel like I'm lucky in the CRPS world. It rarely keeps me awake anymore. Like I can walk and all that. Like I would say if there was like a 0 to 10 on my CRPS, I'm probably at like a 2, and I think most people are way up there. So I'm lucky. As a chronic pain patient and a nurse, like there's a huge disconnect there. Like I've talked to a lot of a lot of my clients, a lot of people I talk to, they don't trust nurses, and I don't blame them because you go to the hospital and it is awful. You're gaslit, they can't get your IV, they don't give you your pain medicine on time. They think you're making it, it's just awful. And like we're supposed to be the caring, compassionate ones.
Hmm.
But I hear more and more and more stories of just nurses just being terrible. And I understand from my perspective as a nurse, we're burnt out, we're exhausted, we don't have enough staff, we don't get paid enough. There's a whole thing going on behind the scenes there. And it takes a really special person to be able to go through all of that and still have compassion for your patient.
Yes.
And I work in emergency medicine, and emergency medicine and chronic pain don't mix at all. You come to the ER for chronic pain, there's nothing I can do for you because it's not that that's not what the ER is for. Like I just had my hand inside somebody's chest. Like I can't fix your chronic pain here. And it makes me sad because I feel for them so hard, but I don't have the capacity while I'm there to show that. And I was like, there's something missing in my heart. Like I've got to be able to go show that compassion somewhere else because it's making me so sad. So that's why I started online coaching, because if I can't do that in the hospital, I can do it online. You can do anything online nowadays. And
Right.
I just got super emotional.
No.
But yeah, I just like people, like especially women, I know men go through chronic pain as well. They they're out there and they're struggling, and like I feel like our healthcare system is not doing anything to help.
No.
I try to always advocate, if you have chronic pain and you come in to see me, like I'll ask the doctor like, hey, what can we do for pain? Like I'll do my best. But like I can't do anything without orders, so it's like up to the doctor. And some doctors are really great at being like, yeah, let's give them, whatever. And some are like, no, I'm not going to give them anything. And I'm like, that hurt my feelings. But, it's like I can only fight so much. Sometimes we can't diagnose you, and sometimes we can't fix your problem. And I guess people don't realize that. The ER, we're literally just ruling out that you're not going to die. And then you need to go follow up with someone else. In your body, that fight or flight, your body is feeling threatened. So, like, you are feeling that way, even though, like, yeah, your heart probably isn't going to stop in the next 15 minutes, which is what I'm looking for when you walk in the door.
Yeah.
But your body has a chronic pain, you're in that fight or flight, and you might feel like you're going to die. And that's
Yeah.
a legitimate feeling that people are feeling. A lot of what I do as a coach too with my clients is I manage those expectations of like, hey, when you go in, this is what you can say that'll help you out. This
Hmm.
is what to expect. This is what to say if they tell you no. Like I try to help people through the conversation with their healthcare team to make it a little more productive and help manage the expectations. I feel like it helps a lot. I offer 2 different like programs, and really I can customize it to the person because everyone's so different. I haven't met every scenario, obviously, with my clients. So, like, if I have to change something, I will. But we essentially just kind of start with the basics. We start with, like, what are your goals? Like, what are you looking forward to? Because in order to progress with anything, you have to have something you're looking at. Like, I want to do this, or I want to get this job, or I want to lose 10 pounds, whatever it is, we'll figure it out together. If it's, I want to be able to go on a walk, that's perfect too. It doesn't matter what it is. So go through that, figure out what we can do to get you there, figure out if it's realistic. And before, you get into my coaching, we have like a free consult, and I make sure that I can actually help you, because I do recognize that there's like a lot of situations out there that I might not be the appropriate person to help you. Cancer, pain, like you talked about the wounds down the spine, that's out of my league for sure. So we talk beforehand, of course. Then we go through the psychology of pain. So I teach you like nerve endings, how the brain processes pain, a little bit of anatomy and physiology related to your own disease, if I do have that knowledge, and just so you can kind of understand how your body works. And then we go into things like mindset, just kind of your daily habits, honestly, your nutrition, how you move, those kinds of things all definitely affect, musculoskeletal pain to a huge degree. And then we go through, if you're wanting more career success or school or anything, we'll go through how to manage chronic pain at school, how to manage at work, going to doctor's appointments, managing at the ER, flares. I mean, we really just go through anything and everything that I possibly can. Back before I was diagnosed with endometriosis and I was having this like chronic pelvic pain, I started having severe pain, like extra, in my right lower quadrant. And I went to the emergency room, and this doctor, who he told me, he was like, I'm not feeling well today. I'm sick, blah, blah, blah. So, what's wrong with you? And I was just like, okay. Told him about my pain, told him I've been having like chronic, pelvic pain. And he was just like, okay, like, what do you want me to do for you? And I was like, literally in tears, like shaking, tachycardic, like just couldn't even stand it. So he gives me some Ativan, which is like a anxiety medication. It helps for pain, but it doesn't help for pain. And did some labs and all that, and then sent me home. And I go home and I'm just like miserable, barfing. I mean, just awful. A week later, I was back in the ER having surgery to get my appendix out. And this home slice doctor never even checked my appendix.
Yeah.
Like, you come in with right lower quadrant pain, you're getting a CT scan. And like,
yeah, really.
as an ER nurse, I just want to go back in time and just like,
shake somebody. Yeah.
And like, I was in the hospital for like 9 days after this. There was a complication. I had like a central line, I had an NG tube. It was the most miserable part of my entire life. Like, I have flashbacks of laying in that hospital bed, just feeling absolutely miserable. No one coming to visit you, being drugged up and just in pain and uncomfortable and just feeling awful. And, I've been a patient in the hospital several times. Nothing was ever as bad as that. But I think that made me realize, like, man, these patients go through it. Like, that was probably nothing compared to a lot of people. And like, even just to get a little taste of that misery has made me compassionate, because it's like, I've been through it. Like, I know what it feels like. There's a compassionate side, but like, I also want to encourage people to take a little bit of personal responsibility as well. Because, if you're waking up and you're just eating like crap and you're not really like there's nothing to motivate you, and you're just complaining all day and just stuck in this negative cycle, like, that doesn't really do you any good. And like, it has to be you who kind of breaks that cycle. And it's hard to do that. Like, I was on antidepressants for years. Like, I completely get that, like, laying in bed miserable, poor me attitude. And it's like, you do have to change your mindset. And like, your mindset is a huge deal when it comes to chronic pain. And it's, a lot of people are like, well, you're just saying that it's all in my head. I was like, that's not what I said. I'm just trying to help you, like, get some personal responsibility going, because it might help you and it might improve your life a little bit. And like, I still complain. Like, I still have my days where I'm like, this sucks. Oh, sorry, curse a lot. This sucks. And like, I'm miserable and I don't want to do this and all this other stuff. And like, that's when I notice that my pain starts to get worse and worse and I start to spiral. And now that I know that, and if I can help you like navigate those feelings and appreciate those negative feelings, work with them, acknowledge them and use them, but also try to like steer yourself in a more positive direction, it can start to help you out. I will spend 80% of my time encouraging my clients, telling them they're doing amazing, telling them that they're worthy, that they're loved, and that they're supported, because that's what you need to hear. But it's kind of up to you on what you want to do. So if I make a suggestion or offer some ideas, I'm not making you do anything. You can choose to do whatever you want, and you kind of have to make a decision if you want to try something or not try something. And if it works for you, and if it doesn't work for you, then we'll just re-explore after that. Part of my nursing training is assessing someone's readiness for change, because no one's going to change unless they're ready to do so. And I spend a lot of time trying to educate my patients in the hospital who are smokers, they drink, they do drugs, or anything like that. I could tell somebody all day to stop smoking crack, but if they don't want to stop, then they're not going to.
Yeah.
And so I do have experience with people who I'll be doing discharge instructions at work, and they'll be like, you know what, I really don't ever want this to happen again. Like, how can I prevent this from happening? And that's, I can recognize those comments or those phrases that people say that they're actually ready to do something. And so that's part of my training as a nurse
Oh,
is
love that.
being able to recognize that and not just push something that I feel like people aren't ready for necessarily. So I like that. I think that makes me a little bit unique as a coach as well. I've been married for 2 years and known my husband since we were teenagers. So we've been in each other's lives for a long time. And so he's known me, kind of with and without chronic pain. And so we actually had this conversation a few months ago. I asked him, I was like, can you just like write down your thoughts that you have toward me about chronic pain? And like, I don't care what it is. I just want to know where your head's at. And
Hmm.
it turns out we were kind of on two different pages and we just didn't know. And so I think the first step is to talk about it, to just be clear about like, what are my expectations? What do I need? And then what does your spouse need from you? And I think that's important in any marriage, is just having this communication of like, what are our expectations in this situation? And then having like a written plan, like a daily schedule or a pain management plan or something that's like concrete of like, okay, here's what I want you to help me with. And then, if it's not on here, then we'll discuss it and we can set those boundaries. So just kind of having like a clear, and not everything's black and white. Like, of course, things come up, but, I think we've kind of learned, my husband is just amazing. He just knows that like I'll ask him for help if I need it. And if I don't need the help, then he knows that, he's there. But
Yeah.
we've set that boundary of like, I'll ask specifically, like, hey, could you help me with this? And it works for us, that way I'm not expecting him to be 100%, 1,000%, 24/7 trying to take care of me.
Hmm.
Um, because that's not what I want from him. Like,
Yeah.
he's my husband.
Yeah.
I love him. Like,
Yeah.
I'm not expecting him to like baby me, but like, yesterday I couldn't really pick up my laundry basket. I was like, hey, could you carry my laundry to the laundry room and I'll take care of the rest? And trying to just balance everything out of like, I'll do this and you do this. I feel like we've just grown closer and closer together, going through everything together. And, it also, I think my like mindset shift also really helped out, because like from a caregiver's perspective, no one wants to take care of someone who's complaining all the time and doesn't want to do anything for themselves. And like having that shift of being like, I'm going to try my best to like do what I can for myself. And then I'll have you help me fill in the gaps. I feel like that helped us a lot, where, we kind of realized that like we're both trying to put in 100%. But I'm like, well, if we can do like 80/20 or 50/50 or whatever this scenario is, that just helped a lot better. So like he knows that like heavy lifting and like all that stuff, like he's got to help me with that. But like
Hmm.
the other things, like the finances and like, you know, getting the grocery list done and all that other stuff, like I can take care of that, no problem. And so we found a better way to like split things up where we feel like we're not like working harder than the other. I think
Yeah.
that's important too. But that's not the reality in everyone's situation. Like if you're bedridden or have severe disability or other things going on, like obviously your situation is going to be completely different. I think I did write a blog post about marriage and chronic pain and put some of what my husband said into it. So I do have that on my website. 90% of like a client issue with having coaching or having a coach is the money part. Like, how do people with chronic pain who can't work, how can they afford to hire someone? They're already like living on like minimal income and like, like that's 90% of the messages I get is like, I can't afford it.
Okay.
And, I want to give people a chance, and obviously I have a business. I can't just like free coaching for everyone. I will work with certain people under certain circumstances for different pricing. I have like plenty of pricing plans. Like I will work with you. And like I try to get people to realize how expensive chronic pain is. Like 10 more years of chronic pain, being miserable and staying in this cycle is going to cost way more money than like this little chunk of like $500, for the next 6 months or whatever.
Yeah.
So it's like, I just want people to realize like, I know when, you hear like, oh, I have to pay a chunk of money, but just kind of think about the long term and think about everything. And then just know that I work with you. Like we
Yeah.
can figure it out. Like, I don't want someone to feel like they can't get to where they want to go. Yeah, I'll be, talking a lot in the next month or so about like the holidays and like how hard that is for people with chronic pain and depression and mental health. And, just realizing like it's September now, like if you were to get in with me for September, just think about how awesome your Christmas is going to be if we're able to like apply some of these principles from now until then. And like that, I used to have like a fear of the holidays, but now I'm like, oh, I'm going to actually enjoy it because, my life is so different. So I feel like
Yeah.
that's a big thing with a lot of people, especially right now, is like September 1st hits, you're like, oh my God, Christmas is here. I'm just here to be a voice for the chronic pain community. And I'm here to be a little bit in your face sometimes and maybe hurt some people's feelings sometimes. It's just a little bit, give you a little kick in the butt, but also be here. I'm not scary. I'm not like crazy
Yeah.
person. I just,
Yeah.
sometimes share things that are on my mind and like things that I wish maybe someone had told me 5 years ago. Like you were saying, it is possible to do something in your life to make your life better. And that's what I specialize in. I'll help you find something. I'm at chronic.pain.coach on Instagram. And then my Facebook is public as Skyanne Prescuta. I'm public on Facebook there, so you can message me anytime. I love getting messages. I love responding. And I'm so happy to I love taking in new clients. So I'm only taking 4 people in September because it's just been, it's kind of a crazy month. So, I have to make sure my schedule and everything, I'm not burning myself out and I can devote my time. So I'm just excited to like dive into like this next season of my life. Very excited. Someone who knows, someone who's been in that hospital bed.
Yeah.
It's hard to find someone like that who like has the knowledge about pain, but also has experienced pain. I see random coaches online with no qualifications and like not even sure like if they've ever really experienced chronic pain before. I mean, I don't know their story, but I just want to get it out there that like, yeah, I mean, I've been through it.
Yeah.
And so I know, like, I understand completely what you're going through, and it's awful. And I want to recognize that, but I want to get you out of it. Chronic pain does not define who you are and what you're capable of. And I know that it feels really heavy and feels like it's the only thing happening in your life right now. But I promise you it's not. And you do have some sort of life, whatever that means for you, waiting for you out there.